D.L. Hughley breaks the news. CNN Saturday night, 10 Eastern.
10 issues in 10 days. Today, we are taking a closer look at the candidates' plans for health care. Certainly something everyone is talking about, and the big push each is making for prevention now. Here's what they're saying on the campaign trail.
We're going to focus on prevention, on promoting wellness rather than just managing sickness. Today, we spend less than 4 cents of every healthcare dollar on prevention and public health.
We need to create a next generation of chronic disease prevention, early intervention, new treatment models, and public health infrastructure.
Joining me now is our Chief Medical Correspondent, Dr. Sanjay Gupta, to talk a little bit more about an issue that certainly affects everybody. What types of services are they talking about now? Why such a big push for preventive medicine?
Well, this is one area that they both agree in terms of bringing down healthcare costs, which has been a rallying cry when talking about healthcare for almost this entire campaign. There are about 130 million people that have chronic disease, and sort of the point is that we spend so much money managing disease and so little money actually keeping people from getting the disease in the first place. That's the way to think about it. 130 million Americans, about 75% of U.S. health care spending, 1.5 trillion a year, goes towards disease management as opposed to prevention. Now, the point is, what does prevention really do for you? And I think that's the question a lot of people are asking. Medically, it makes sense, right? I mean, who wants somebody to get sick in the first place? They don't live the life that they want to live. But it can also make you live longer with some pretty simple changes. Some things that we've talked about in the past, obviously quitting smoking, that adds 10 years. We say it all the time, 10 years. Healthy blood pressure adds 5 years. You can see the numbers there. Lower cholesterol adds 3 to 8 years. Simply keeping a healthy weight, body mass index less than 30, can add 3 to 4 years as well. These are things that we sort of know, but there's not enough emphasis in our healthcare system towards making people actually live longer through these means.
Yeah, I mean, I kind of chuckle at the BMI thing because we just bought the, I won't use a product name, but a certain computer program at home where you stand on it and it gives you BMI
What was
every
your
day.
BMI?
It was normal. It was normal. Thank you very much.
Just kidding.
But you know, when
never
you
ask a
about,
woman her BMI.
I'll tell you after. When you talk about prevention, there are some people who would say, you know, it costs an awful lot of money to work on preventive medicine programs. But as you just said, isn't it less expensive in the long run if you don't get sick to begin with?
This is surprisingly controversial for the reasons that you mentioned. People say, look, it costs so much money to transfer the system, this radical change from disease management to prevention. It is going to cost more money up front to do more screenings, for example, to get nurses into homes, to do blood pressure screenings, to do blood glucose screenings. But again, medically as a doctor, these make sense. There's also a potential risk of overdiagnosis, meaning you take a healthy population, you do a CAT scan, and they see something. Well, that might lead to a biopsy, may lead to an operation. That obviously can cause anxiety and more money. But in the end, prevention seems to medically make a lot of sense because it keeps people healthier.
Yeah, and there are a lot of services out there, aren't there? I mean, preventative-wise that are underused. People don't really tap into it.
Great point, because a lot of things, for example, cancer screenings, which we're talking about, which, you know, for women over the age of 40, they should be getting mammograms. Certain federal entitlements already allow mammograms to be paid for. Prostate cancer screening for men over the age of 50, same sort of thing. So there are some preventive services already available, and you have to check with your doctor or health care insurance company about
it's a good point. Certainly, like we said, one of the issues that everybody is going to be talking about, and still talking about. We only have 7 days to go.
I know, can't believe it.
Dr. Sanjay Gupta.
7 issues, 7 days.
That's right. That's very good. We'll talk with you again shortly. Thanks so much. Meanwhile, education is what we'll be talking about as we keep breaking down the issues that matter most to you. Tomorrow, we are all about education. From No Child Left Behind to keeping both teachers and students in the classroom, the problems and the plans. 10 issues in only 10 days, only on CNN. An Oscar-winning actress's real-life tragedy.